Now, health authorities in the Sekyere East district of the Ashanti region say they are overwhelmed by high incidence of scabies in senior high and basic schools in the district. The contagious disease has infected over 1,800 students in 7 senior high and basic schools. District Health Director Justice Oforie has appealed for stakeholder support as the directorate struggles to contain the spread of the diseases in the schools. Ohiming Terry of our health desk has more in the following report.
Neglected tropical diseases have been generally wiped out in developed countries, but it persists in poor and marginalized nations. Health officials in the Sekyere East district say almost every community has recorded a case of NTD. Gideon Asarimante is the Sekyere East District Health Surveillance Officer.
NTDs are scattered across our district. Every single community here can boast of one neglected tropical disease or the other. In Tunkumso, Motokrodia, Senyeja are the communities that have at least 5 or more. Here, you can have about 1,000 and over hamlets around this very area. And these people come with different forms. We have several use cases around this area, scabies, a lot of them, several brulee ulcer cases and other things. What we seek to do is to strengthen our surveillance team. We do a lot of social mobilization, health education in the various communities, just to make sure these people get good knowledge about the neglected tropical diseases so that in case they have them, they are able to report early.
Endemic communities share common deprivation, non-availability of potable drinking water, hard to access health personnel, spirituality, among others. At least 1,834 students in 7 schools have contracted scabies. District Health Director Justice Oforie says the directorate has struggled to contain the spread of NTDs, especially scabies in schools.
NTDs is on the ascendancy here. We have recorded about 8 to 9 different categories of them. The like of leprosy, yaws, scabies, onchocerciasis, lymphatic filariasis, and brulee ulcer. If you take a disease like scabies, as at last month we had recorded 1,834, and typically it's among the ages of 14 to 19. And that is the school-going age. And some of our senior high schools is very high there. We had about 4 senior high schools in Efigase and 7 lower primary schools in Efigase. So the number is quite huge. BU, we have a lot of them here. And they report at a very late stage where there are a lot of deformities and complications. Even last week, with the support of World Vision, we had to transport about 6 of them to Agogo Presbyterian Hospital for surgery. And if we had not taken them, the end results would have been amputation of their legs or the arm.
Mr. Oforie says despite improved surveillance at the health directorate, public apathy leading to late reporting of cases is making containment difficult. He wants all hands on deck to contain the situation.
The nature of the disease is so contagious that as you fight it from this side, it begins to come from the other side. And therefore, we need to attack the disease holistically, involving all stakeholders, bringing them on board Zoom Lion, Ghana Education Service, Ghana Water Company, because it's a water-related disease. So it's very high. Most of them think that it is a disease which doesn't have a cure at the hospital. All the conditions. Brulee also, they think that it's a curse. Scabies, they think that somebody has cursed you. You want to steal something as a schoolboy and you have been cursed. That is why you are scratching your body. There is medicine for it. If you take leprosy, we have recorded so far about 4 of them. These people think that it is a curse. So that perception we hold as a community, as a people, must be cleared off. We need a very pragmatic effort to get all these cases recorded earlier giving them appropriate treatment.
From Efijase in the Ashanti region for Joy News, Oyemi Interia reporting.